The cure existed. That's the fact this entire story turns on. Not the disease, not the racism, not the bureaucracy. The cure existed, had existed for years, and the men in Macon County, Alabama did not receive it. Not because it wasn't available, not because no one knew, because someone decided they shouldn't. The version of this story most people carry goes something like this. A medical study from a less enlightened era, a government that didn't know better, a tragedy that produced reform. Something that happened, something that ended, something we fixed. That version is easier. It is also not what the documents say. What the documents say is this. In 1947, penicillin became the standard treatment for syphilis. Effective, cheap, widely available. The Public Health Service knew this. And in 1947, the same year, the PHS made a documented, discussed, formally decided choice. The men in Macon County would not be treated. Not an oversight, a decision. They kept making that decision for 25 more years. In 1966, an internal employee put it in writing that what was happening was ethically indefensible. The institution reviewed his complaint, assembled a panel, and concluded the study should continue. In 1969, the CDC, the Centers for Disease Control, conducted its own review. They understood exactly what was happening. They voted to continue. In 1972, a journalist published the story. Congress held hearings. Reforms were written. An apology was delivered, eventually, by a president who had not been involved. No one was prosecuted. The men who made the decisions died as respected members of the American public health establishment. And in 1973, a Senate subcommittee reviewed every document, every memo, every signed exemption request, and settled on a single word to describe what had happened. Not negligence, not oversight, deliberate. In 1966, a man named Peter Buxton wrote a memo that should have ended this. What happened to that memo, and what it took to finally force the truth into public view, is in Act 4. And the document that makes the passive neglect narrative completely impossible to sustain is there too. It has a signature. It is dated. And it is still in the National Archives. This is the Tuskegee experiment. And it did not end the way you think it did. In 1966, Peter Buxton wrote a formal memo to the Public Health Service. He wasn't a journalist. He wasn't an activist. He was a PHS employee, a venereal disease investigator working inside.
Enjoying the story so far? Subscribe to Untold History and keep discovering the past they never told.
The same agency running the study. And what he wrote wasn't an accusation. It was a procedural complaint. Measured, professional, addressed through the correct internal channels. He identified the Tuskegee study as ethically indefensible. The PHS responded 8 months later, not to shut the study down, to convene a review panel, made up almost entirely of individuals who had been involved in the study from the beginning. The panel's conclusion? The study should continue to its natural endpoint, which meant until enough participants had died. Buxton filed a second complaint in 1968. He was told, again, that the study had scientific merit. What makes this specific detail matter is the date, 1966. Penicillin had been the standard treatment for syphilis since 1947. That's not a contested number. It's in every pharmacological record from that period. By the time Buxton wrote his first memo, the men in Macon County had been living with untreated, progressing syphilis for 19 years after the cure already existed. The PHS knew this. The review panel knew this. And their documented conclusion, preserved in the National Archives, reviewed by the Senate subcommittee in 1973, was that scientific continuity outweighed treatment. That phrase deserves to sit alone for a moment. Scientific continuity outweighed treatment. This was not a decision made in ignorance. It was a decision made in full possession of the facts, written into official correspondence, filed, archived, and signed. Buxton didn't stop there. Between 1968 and 1972, he continued pressing internally. He was not fired. He was not disciplined. He was simply not heard, which, in institutional terms, is a more efficient outcome. A dismissed employee becomes a story. An ignored one disappears into the record. In 1972, Buxton took the documents to a journalist named Jean Heller at the Associated Press. Her story ran on July 25, 1972. Within days, the study was terminated. It had been running for 40 years. The cure had existed for 25 of them. What the internal review panels never addressed, what none of the official correspondence touches, is a specific intervention that went beyond simply withholding treatment. And then there's the letter. In 1932, the United States Public Health Service launched what it called the Tuskegee Study of Untreated Syphilis in the Negro Male. The name was clinical. The justification was scientific. And by the standards of what American public health research looked like in 1932, it fit recognizably inside that framework. Syphilis was a serious and poorly understood disease. In the rural South, it was epidemic. In Macon County, Alabama, one of the poorest counties in the United States, infection rates among black men had been estimated at nearly 36%. There was no meaningful healthcare infrastructure in the region. There were no black physicians. There was, for most residents, no access to any medical system at all. The PHS framed the study as an extension of an existing treatment program. Participants were told they were receiving treatment for bad blood, a local term used broadly to describe a range of ailments. They were offered free meals on examination days, free burial insurance, and what was described as free medical care. For men with no access to any health care, this was not a trivial offer. 399 men with syphilis enrolled. A control group of 201 men without the disease were enrolled alongside them for comparison. The study was originally designed to last 6 to 8 months. That detail matters less than what it implies. The researchers, at the outset, had a defined endpoint. This was not conceived as a permanent surveillance program. It was a short-term observational study, conducted during a period when the standard treatments, arsenic compounds and bismuth, were themselves dangerous, unreliable, and often caused serious harm. There was a legitimate scientific argument in 1932 for studying what untreated syphilis looked like in a population where treatment access was already near zero. The Tuskegee Institute cooperated. Local black nurses, most prominently Eunice Rivers, a trained public health nurse, served as the community liaison between participants and researchers. Rivers was trusted in Macon County. Her presence gave the study a human face and a degree of cultural credibility that the PHS researchers, all of whom were white and external, could not have established alone. Participants called her Nurse Rivers. Some of them stayed in the study, in part because of her. The treatment had a name. It cost less than $1 a dose. By the early 1940s, the study had continued well past its original timeline. When the United States entered World War II, several participants were called up for military service. Standard procedure for draftees included syphilis testing and, if positive, mandatory treatment. The participants would have been treated automatically, without the study team's involvement, without any decision required on anyone's part. The PHS contacted local draft boards. They requested that the men from the Tuskegee study be exempted from the treatment requirement. The draft boards complied. The men were listed as available for service, but flagged to ensure they would not receive syphilis treatment during their military physicals. They went through the system. They were examined. And the one intervention that would have cured them was withheld, by design, at the specific request of the research team. This detail was not widely reported when the study was exposed in 1972. It appeared in the congressional testimony. It is in the record. But it did not become part of the story most people carry. The study, as the public came to understand it, was a story of neglect, of a government that simply didn't act. The study, as the documents describe it, was something with a different structure entirely. The study ran for 40 years. Penicillin had existed for 25 of them. Deliberate. That's the word the Senate subcommittee used in 1973. Not oversight. Not institutional inertia. Not a failure of communication between departments. Deliberate. In 1947, the Nuremberg Code was established in direct response to the medical experiments conducted in Nazi concentration camps. It set out 10 principles for ethical human experimentation. The first principle, the one that precedes all others, is informed consent. The subject must have the legal capacity to consent, must exercise free choice, must have sufficient knowledge of the experiment to make an informed decision. The PHS was aware of the Nuremberg Code. It was discussed internally in correspondence from the late 1940s onward. It appeared in the bioethics literature that PHS researchers read and cited in other contexts. It was not obscure. It was not buried. It was the central document governing human experimentation in the post-war period, and it described with precision exactly what was being done in Macon County. The men in the Tuskegee study had never been told they had syphilis. They had been told they had bad blood. They had not consented to participate in a study of untreated disease progression. They had been told they were receiving treatment. The distinction is not subtle. It is the entire architecture of the study, the reason it could continue, the reason participants kept showing up, the reason Nurse Rivers could maintain trust without lying in any single conversation, while the institution she represented maintained a systematic deception across 4 decades. He signed the exemption request. The draft board exemption, the intervention that blocked military treatment during World War II, required a signature from the study's lead researcher. That signature exists. It is in the National Archives. It is dated. It names the study. It requests, explicitly, that the listed men be prevented from receiving syphilis treatment through the military medical system. This is not a bureaucratic footnote. It is the clearest single piece of evidence that the withholding of treatment was not passive. It required action. It required someone to identify the men, prepare the documentation, contact the draft boards, and sign their name to a request that would ensure 28 of their research subjects would continue progressing toward organ failure, cardiovascular damage, and death. Someone did that. The signature is legible. What the 1973 Senate hearings established, through testimony from Buxton, from surviving participants, from PHS officials who had been involved at various stages, was a timeline that made the passive neglect narrative impossible to sustain. 1947. Penicillin established as standard treatment. 1947. PHS internal discussion of whether to treat participants. Decision: no. 1948. Study continues. 1950s. Participants develop late-stage complications. Study continues. 1966. Buxton files first complaint. Review panel convened. Study continues. 1968. Buxton files second complaint. Study continues. 1969. CDC reviews the study and recommends continuation. That last entry requires a pause. 1969. The CDC reviewed the Tuskegee study and recommended it continue. This was not a rogue operation running below institutional visibility. In 1969, the Centers for Disease Control, the same agency that today coordinates the national response to infectious disease, examined what was happening in Macon County, understood what was happening in Macon County, and concluded that it should keep happening. The recommendation is in the public record. There's a document that the Senate subcommittee entered into evidence in 1973. It is an internal PHS memorandum, written not in 1932, but in 1969, after the CDC review. It discusses the study's remaining participants, their current health status, and the projected timeline to natural endpoint. It does not use the word cure. It does not use the word treatment. It uses the phrase study completion, and it calculates, with the clinical precision of a budget projection, how many participants were expected to reach that endpoint before the others. The 1969 CDC memorandum entered into Senate evidence is 11 pages long. It was written by Dr. David Sencer, then director of the CDC, following an ad hoc committee review convened specifically to evaluate whether the Tuskegee study should continue. The committee had 13 members. 3 were black physicians. According to the testimony of Dr. Vernal Cave, one of those 3, the black members of the committee raised objections. They were noted in the record. They did not change the outcome. The committee voted to continue the study. The memorandum that followed does not read like a document written by people who believed they were doing something wrong. It reads like a resource allocation assessment. It discusses the remaining cohort size. It projects attrition. It identifies which participants had progressed to tertiary syphilis, the stage that affects the cardiovascular system and the brain, and notes their value to the study's longitudinal dataset. That phrase, value to the dataset, appears.
Enjoying the story so far? Subscribe to Untold History and keep discovering the past they never told.
In reference to men in the late stages of a curable disease. According to the testimony of Dr. J. Katz before the Senate subcommittee in 1973, Katz was a Yale Law School professor and one of the architects of modern bioethics. The Tuskegee study represented not an aberration, but a logical endpoint of a research culture that had never meaningfully integrated the concept of patient consent. His testimony cited the Nuremberg Code directly. He noted that American researchers had largely treated it as a document about what the Nazis had done, not as a set of principles that applied to American institutions. The Nuremberg Code, in American medical research culture, was for other countries. And this is where it gets interesting, because the Tuskegee study was not a secret. It was published. Between 1936 and 1973, the PHS published 13 peer-reviewed papers in mainstream American medical journals documenting the study's findings. The 1936 paper appeared in Venereal Disease Information. The 1955 paper appeared in Public Health Reports. The methodology, observational study of untreated syphilis in a defined cohort, was described openly. The racial composition of the study group was described openly. The fact that participants were not receiving treatment was described openly. These papers were read. They were cited. They passed peer review. No journal editor raised an ethical objection. No peer reviewer flagged the consent structure. No medical association launched an inquiry. For 37 years, the study existed not in a classified file or a locked cabinet. It existed in the indexed, accessible professional literature of American medicine. When Jean Heller's AP story broke in July 1972, the reaction was described as shock, congressional outrage, public horror. But the information had been available, in print, for decades. What changed in 1972 was not the existence of the evidence. What changed was that the evidence moved from a readership of medical professionals who had collectively decided for 37 years that it did not require a response, to a general public that had not been part of that decision. The shock was real, but it was not, strictly speaking, about discovery. It was about who was now being asked to know. When the study ended in 1972, the Public Health Service released a statement describing it as a tragedy. The word they used was tragedy. Here is what the numbers looked like when the study ended. 28 men had died directly of syphilis. 100 had died of related complications. 40 wives had been infected. 19 children had been born with congenital syphilis. Those children, 19 of them, were born with a disease that had been curable since 1947. Their mothers were infected by men who had been enrolled in a federal health study. The study knew the men were infected. The study knew the men had wives. There is no document in the record indicating that the lateral transmission risk to partners and children was ever treated as a variable requiring intervention. It was, at most, noted. The 1969 memorandum does not mention wives. It does not mention children. It mentions data set integrity. In 1997, President Clinton issued a formal apology on behalf of the United States government. 8 survivors attended the ceremony at the White House. The youngest was 87 years old. He had enrolled in the study in 1932. He had been told for 40 years that he was receiving treatment. He was still alive only because his syphilis had progressed more slowly than the researchers had projected. Clinton said, "What was done cannot be undone." He was correct. In 2016, a study published in the journal Proceedings of the National Academy of Sciences attempted to measure something that had never been formally quantified: the effect of the Tuskegee revelation on black male life expectancy in the United States. The researchers, Marcella Alsan and Marianne Wanamaker, compared mortality data and healthcare utilization rates for black men before and after 1972, controlling for geography, income, and access. Their finding was specific and measurable. In areas closest to Tuskegee, black male life expectancy declined relative to comparable groups after the story broke. The effect was largest among older black men, the demographic most likely to have direct knowledge of the study or personal connection to it. The paper estimated that the Tuskegee revelation accounts for a reduction of roughly 1.4 years in black male life expectancy, driven not by the study itself, but by the avoidance of medical care that followed the exposure. The study killed 28 men directly. The distrust it created may have killed orders of magnitude more. This is the mechanism that makes Tuskegee contemporary rather than historical. It is not that people remember the study. Most people, including most of the black Americans whose healthcare decisions are shaped by this history, do not know the specific details of what happened in Macon County between 1932 and 1972. What they carry is not memory. It is a rational inference passed between generations. That American medical institutions have, in documented and verifiable instances, treated black bodies as research material rather than patients. That inference is not paranoia. It is the correct conclusion from the available evidence. When COVID-19 vaccine hesitancy became a public health priority in 2021, the CDC commissioned focus groups to understand resistance in black communities. Tuskegee was named, unprompted, in session after session. Not as a historical reference, as a reason. Public health officials responded, largely, by attempting to reassure, to explain that modern oversight structures, IRB requirements, and informed consent protocols made a repetition impossible. What they were less willing to engage with was the more precise question. Not whether Tuskegee could happen again in its exact form, but whether the institutional logic that produced it, the logic that calculated dataset integrity against patient welfare and chose the dataset, had been fully excavated and removed. The IRB system that now governs American medical research was created in direct response to Tuskegee by the National Research Act of 1974. The Belmont Report followed in 1979. These are real reforms. They have prevented specific categories of harm. They were also written by institutions that, 2 years earlier, had allowed the study to continue for 25 years after the cure existed. The question of whether a system can reform itself using the same reasoning that produced the problem is not rhetorical. It is the central, unresolved question in the history of American public health. There is one more detail that does not appear in most accounts of this story. In 1997, after Clinton's apology, the government established the Tuskegee Health Benefit Program, providing lifetime medical benefits and burial services to surviving participants and their families. The program was extended over subsequent years to widows, children, and grandchildren of participants. It runs to this day. As of 2023, the program is still active, which means that in 2023, 91 years after the study began, the United States government was still paying in a direct and bureaucratically continuous line for what was done in Macon County. The file is still open. Someone made that calculation in 1969, dataset integrity against human life, and chose the dataset. The question is whether anyone was ever held responsible for it. No one went to prison. No one was fired. No one was prosecuted. No one who signed the draft board exemption requests, who voted to continue the study in 1969, who reviewed Buxton's complaints and filed them away. None of them faced criminal charges. The Senate subcommittee held hearings. The reforms were written. The apology was delivered 25 years after the study ended by a president who had not been involved. The men who made the decisions died, largely, as respected members of the American public health establishment. This is not an oversight in the accounting of Tuskegee. It is the accounting. What Tuskegee reveals, when you follow it past the initial horror of the facts, past the apology, past the reforms, is something structural. Not a conspiracy. Not a group of villains who knew they were villains. Something more difficult than that. It reveals what institutions do when the cost of a decision is paid by people who are not in the room where the decision is made. The men in Macon County were not in the room in 1947 when the PHS decided not to treat them. They were not in the room in 1969 when the CDC voted to continue. They were not in the room when the peer review committees passed the papers, when the journal editors accepted them, when the grant committees funded the next phase. They were in Macon County, being examined, trusting Nurse Rivers, believing, some of them until 1972, that the government was helping them. The philosopher Charles Mills wrote in The Racial Contract, 1997, that one of the functions of systemic racism is not active malice, but structured ignorance. The production of conditions in which certain facts about certain people are categorically less legible to those with institutional power. The people running the Tuskegee study were not, for the most part, sadists. The documents don't read that way. They read like people who had genuinely ceased to process the men in Macon County as patients. They had become, in the language of the institution, a cohort, a data set, a longitudinal sample with a projected endpoint. The violence was in the vocabulary, and the vocabulary was entirely normal. That is what makes this story matter beyond its specific facts, beyond Macon County, beyond 1932 to 1972, beyond the 399 men and the 19 children and the 40 wives. Every institution that has ever calculated the acceptable cost of harm to people who are not in the room and decided the cost was acceptable has used a version of that vocabulary. The words change. The structure doesn't. Peter Buxton, the man who finally broke the story, was asked in a later interview why he kept pushing after being ignored twice. He said he didn't have a complicated answer. He said, someone had to say it was wrong. Not someone with more authority. Not someone from outside the system. Someone already inside it, already holding the documents, already knowing that the correct channels had failed. Just someone who said it was wrong. That's a small answer for a 40-year crime. It is also, if you look at the history of how institutional harm ever gets interrupted, usually the only answer there is. If deliberate medical neglect could be sustained for 40 years inside a federal health agency, reviewed, funded, published, and defended, what other decisions are currently sitting in a file, waiting for someone to say it was wrong? Tell me in the comments what you think the answer is. Next week, we uncover the disaster that NASA's own engineers predicted in writing, and the one phone call that could have stopped it. The file is still open. It has always been open. We just don't always know where to look.